Hi, Tina Ketchy Stearns back with a couple of maybe surprising things that doctors don't realize when they are trying to decide if their patient is appropriate for hospice or not. We're going to talk about two common misconceptions among medical providers, and that one is a full code and one is feeding tubes. Just because a patient wants to be a full code does not mean they're not appropriate for hospice. So let me explain. When someone is a hospice patient and they want to be a full code, which means if their heart stops, they want you to do CPR. You can certainly be a hospice patient and be a full code. We will be calling 911 EMS to come take you to the hospital so that they can try to resuscitate you. Of course, that will happen as soon as they get on site and then in the truck on the way to the hospital. So you absolutely can be a full code if that's what the patient desires and still be on hospice. We're going to do a lot of education with the patient and the family around the realities of that, especially in the elderly community, in that the success rate of bringing somebody back, getting their heart started again, once it has stopped, is about 0 to 1% in the elderly. It's not a whole lot better in younger populations, especially if your health is already compromised, which makes you a 6 month or less prognosis, means you're appropriate for hospice. So if you're already in this 6 month or less situation, you might be quite ill. And so it's a very small chance that the medical providers will be able to get your heart started again. The other thing about that is, do you really want the last sound you hear to be your ribs breaking under chest compressions? Because that happens. But if you want to be a full code, totally fine, that's your right. Second thing is feeding tubes. Some people think just because you have a feeding tube means you can't go on hospice care, and that's not true. The question is, what is the purpose? What is the goal of the feeding tube? Are we trying to sustain life for months and months? If that's the case, then no, it's probably not appropriate for a hospice patient. Are we waiting for brother to fly in from California? Okay, that's a different story. We will talk to the family and the patient regarding if it gets infected, if it comes out. We're probably not going to put it back in. But just because you have a feeding tube doesn't mean you cannot go on hospice care. So if you're a medical provider and also family member, I hope that was helpful for you. Please comment if you've got any questions. Would love to talk with you further about that. And I will see you next week. Thanks.